So I'd like to welcome everyone to this Ontario Trillium Foundation recognition event for our CCRC grant from the Resilient Communities Fund this morning. I would like to do a land acknowledgement. So CCRC respectfully acknowledges that we live, work, and provide services on the traditional territory of the Mississauga and Anishinaabe and in the territory covered by the Williams Treaty and Treaty 20. We give thanks to the First Peoples for their stewardship and teachings about this land. We recognize the historical and ongoing oppression of Indigenous people in Canada and that the impact of this oppression will be felt by generations to come. We commit to learning from, listening to, and building relationships with Indigenous peoples. We commit to taking action toward achieving the goals of allyship, reconciliation, and decolonization. So with that said, welcome especially to MPP Smith for coming today for this. I would like to introduce MPP Smith as the first speaker.
Thank you very much. It's great to be here today on this. When we take a look at what has happened over the course of the last 2 years, COVID has put a tremendous stress on a lot of different people, a lot of different organizations, but CCRC has continued throughout and continued to support people throughout COVID, and I commend you on that. Today's announcement for $55,900 from the Ontario Trillium Foundation, from the Resilient Communities Fund, is something that I think is welcome news for you. It gives you the ability to purchase another laptop, increase some of the things that you were doing on the programming side, and help with the Housing Help Clinic at the CCRC. All throughout COVID, what we have seen is that organizations such as yours had a little bit of trouble doing their core mandate. Most of what you would have done would have been in person with people. It would have been that personal contact, and you weren't able to do it. But you continued on, and you did to the best of your ability, supporting individuals who found themselves in precarious situations. This grant, I think, moving forward is going to give you that opportunity that not only when we come out of COVID, will you be able to continue with the good work that you have been doing, but it puts you in a position where if we find ourselves in a pandemic again in the near future, if we find ourselves in a position where we're not able to gather as individuals or in groups, you have the ability then to continue with the good work that you have been doing. So I thank you so much for reaching out, for applying for the grant, because I know the work that you do in this community is something that is very much needed. And thank you for continuing to do it.
Okay. Thank you for that. And next we have Kirsten Armburst, the Executive Director of CCRC.
Okay. Yeah, so first of all, I would just like to start by, expressing our thanks for the province of Ontario for supporting this project. And I think, you know, obviously about CCRC, we've been around for a long time, 65 years. We're multi-service accredited agency, part of Family Service Ontario. So CCRC has been around for 65 years, but the Housing and Resource Centre itself has been around for over 30 years. So we've worked throughout that time providing services to people who are homeless or at risk of becoming homeless. And as you said, it's been something that we've done largely in person over the past 30 years. And of course, with the population that are seeking the services of HRC, it's been that much more important to be able to provide those services in person, as access to virtual or remote options are not always there. So with this grant from the Ontario Trillium Foundation, we've really been able to add services, add supports, provide more in-person supports when it's been safe to do so, but making sure that we're doing everything that we can to protect our staff and our clients. So it's been really an amazing help, and I think that it really goes to support the community in ways that we would have been really taxed to do so, had we not been successful. So just on behalf of CCRC and all of our clients, and really the residents of the community, we just want to express our sincere thanks for the support.
Thank you, Kirsten. And now Annie Hedden, who is the manager of the Housing Resource Centre and the Community Service Orders Program.
Thank you, Sarah. Thank you, Kirsten and MPP Smith, for your comments there. Throughout the COVID-19 pandemic, it's been more important than ever that people have adequate housing and that they have the services and supports that they need to find, secure, and maintain that housing. We're very fortunate to have received an Ontario Trillium Fund Resilient Communities grant to support us in this work, because at the same time as the need for services is growing, providing those services has become much more complicated. Most notably for us here at the Housing Resource Centre, the complexities have arisen at our Housing Help Clinic, which provides in-person drop-in services primarily to really vulnerable community members who are experiencing homelessness and who are seeking support to search for new housing. So many of the folks who use the clinic don't have reliable or consistent access to telephones, computers, the internet. Many don't have the knowledge or skills that are required to use technology to search for housing. And housing search activities are increasingly occurring primarily online. And in addition to exacerbating this technology gap, the pandemic has also brought an increase in the complexity of need that we're seeing in the households we serve. This means that it takes longer for our clients to explain their situations to us and for us to assess their service needs. So during the pandemic, the intake worker reported spending on average 50% more time addressing each service request. This is partly due to the increased complexity of our client situations, but it's also because our staff need to take extra health and safety precautions around COVID-19. Things like conducting COVID screening, providing PPE, and cleaning and disinfecting after each client. So when we put all of those different activities together, we found that effectively the clinic was operating at 50% capacity, all while the need for drop-in services was increasing. So this led to a tremendous increase in wait times for service for folks whose situations were quite urgent, who couldn't afford that wait time. Clients were often waiting upwards of 30 minutes for service. And many clients who were unable to wait didn't receive services in the end. So there were challenges for clients. There were also challenges for staff. If the intake worker didn't pass our required daily COVID screening, the clinic couldn't operate. And the devastating result was that we were sometimes unable to intervene in time to prevent housing loss or to secure new housing for a client. Having that extra staff person that the Ontario Trillium Fund grant allowed us to hire reduced the number of times we needed to close the clinic when staff weren't available to run it. Because we had that extra person available to attend the office to provide in-person services as needed. The grant helped us to meet our mandate to prevent homelessness by restoring Housing Help Clinic operations to full capacity. It allowed us to increase our staffing capacity by 1 full-time intake worker. It doubled our client service capacity on the drop-in clinic. And allowed us to reimagine the ways in which we provide housing help services to meet the needs of staff, clients, in the community. So we were able to reduce those wait times for in-person service by adapting our service delivery model to increase our ability to respond to service requests by phone, text message, and email for those clients who were able to use that technology, and to increase our capacity to provide in-person services to those who weren't able to use the technology. Overall, it increased the total number of service requests we were able to respond to. And we're very, very grateful to the Ontario Trillium Fund for providing us with the grant that restored that capacity during a time when services are especially difficult to provide and housing is especially difficult to attain.
Okay, thank you, Annie. were there any questions or anything else that anyone wanted to say?
You might want to introduce Tanis as our.
Oh, I'm sorry. And we have Tanis Howell here. Tanis is the chair of our board of directors. Sorry, Tanis.
Thanks, Dave. I met you previously through a meeting with Kawartha Pine Ridge District School Board in the fall when we were talking about some programs with our director there. So nice to see you again, and thank you. Thank you for your support.
Not a problem. Thank you.
So if there aren't any further questions or anything, that was everyone that was going to speak today. And since I have the screen recording, then I can do a screen capture from that. So that was it. Thank you so much, everyone, for joining us. And again, we were thrilled to receive this grant. As Annie mentioned, it made a huge difference for a number of people in our community in our ability to deliver services. So thank you so much.
Nice to
You're
meet
welcome.
you.
Thank you.
Good news.
Thank you.
Thank you.
Okay, take care.
Bye-bye.
Bye.